what we tried to do in this study was look at what are the major benefits of health IT, and then what are the major barriers right now for why we haven't adopted health IT. So in terms of the benefits, the big benefits are that it reduces cost, that it improves quality of care, and that it increases access to health information for both patients and doctors. Now when you kind of dig into that, in terms of cost, the cost savings are huge. We're talking around $80 billion per year over the next 15 years. If you've noticed some of the presidential candidates, they're using health IT as a way to pay for their idea of universal coverage, because they're saying, well, we could save, they use higher numbers, they say maybe $100 to $120 billion a year, but that difference in the money will actually fund universal health care. So this is obviously huge savings that we're looking at. In terms of quality of care, there's lots of areas where you can improve quality of care. One of the big ones is the computerized decision support systems. And these are systems that really help doctors. When the doctor's with the patient, the doctor can go and enter in the treatment that they're going to prescribe to the patient, put in the doctor's orders, and the computer might flash back and say, you know what, you need to consider the fact that this patient has this allergy in their record, or that they have this history, or that maybe there's this new drug out there that you haven't heard about that's more effective for this specific person because of certain characteristics in their electronic health record. So that's kind of a big issue in terms of improving quality and improving performance in the medical practices. And the last area, of course, is improving access to information. There's really two big sides for this. One is the patient. Right now, most patients never see their health information. The result of that is that the quality and the health records aren't as good as they could be. You don't have the person who really knows their medical information looking over them. It also means patients can't really be actively involved in tracking their performance. I don't know about you, but when I go to the doctor, they tell me what my blood pressure is. I don't actually know what that means. If I didn't write it down or have it sent to me, I would have no way of what they're telling me is a good thing or a bad thing, or if it's really even changed. With these kind of electronic health records, patients can go and track and see how they're performing and know, okay, this is a good thing. Or, every community can kind of band together and build their own network. So the hospitals and the nonprofits in the area, the local doctors' offices, the insurers maybe specific to that area, all get together and they build their network. And they figure out how they want to exchange data. And the idea is it's a community-led effort. And that's why it had a lot of initial appeal. And then the idea is you have all these different communities. I mean, some of these are maybe county-wide, city-wide, others are statewide. They would all eventually network their networks together, and this is how we'd end up with a national health information network. I mean, the internet, of course, is allowing people to access many new applications and get them involved with information that they never knew they could even access. Broadband especially will help for things like remote health monitoring. I was just talking to somebody about, and this is in the report, Medtronic has a device. They make defibrillators for your heart and other cardiac devices. And they have devices that actually transmits from inside you wirelessly to another device, and it records how your heart's performing and how the device is performing. It will transmit it to this device, and that device can be connected to the internet or your telephone, and it dials back into the computer system, and then the doctor can check in on the patient, see how they're doing. So the patients can travel, they can skip many appointments. And these are the kind of things that you don't see you wouldn't see without internet deployment. You also have things like the EICUs, the intensive care units, where you can do remote monitoring. And these take multiple signals. I mean, you obviously want video, you want the different kind of vital signs that will be picked up within the ICU unit. And all of this, of course, requires high-speed internet access, especially, of course, in rural communities where they're less likely to have an intensive care specialist.